Everybody knows that sauna is good for our health. But after this video, you will know how to use it, when to use it, what temperature need to be used to make optimal benefit for our health. My name is Dr. Ostrochininov. I'm founder of Science of Massage Institute, and I have 30 years experience practicing and teaching medical massage around the world. Let's discuss this important subject in this short video. So, saunas everywhere. In the gym, in someone's houses, you can go with your friends, enjoy it in the spa, and it's really a very helpful tool to maintain our health. However, let's discuss what actual clinical benefits sauna has on the human health, and also how to use it properly. Because if we are not using it properly, then instead of actually having benefits, it creates adverse effects. So that's subject of our discussion. Let's start from general aspects of sauna application. Mayo Clinic recently published review of sauna impact on healthy population in Nordic countries like Finland, Sweden, and link to this study in the description. The authors concluded that regular sauna application decreases stress level, produces vasodilation of coronary arteries and decreases hypertension, decreases cardiovascular disease mortality, decreases risk of dementia and psychotic disorders, open bronchial tree helping patients with pulmonary disorders, unloading kidney, dramatically helping patients with musculoskeletal disorders. And what is more important, it extends life of people who use sauna regularly. And that is now hard medical data. However, there is contraindications to the using sauna. One of them, very advanced coronary disease, very advanced abnormalities in the function of the lungs, glaucoma, for example, or increased pressure within the eye. There is some limitations, but they usually associated with very advanced developments in the patient health. Technically speaking, we can split population who use sauna in two major groups. Healthy people who using sauna as a preventive measure, and people who has different abnormalities and using sauna as a part of the treatment. It's not only treatment, it's supposed to be a part of integrative approach to the therapy, including medical massage. And that's why you have different application for different group. If we're talking about regular people who using sauna for the health benefits, it's much more relaxed rules, because you can enjoy sauna on your own pace and follow basic rules, which we'll discuss later. But when you have chronic conditions associated with dysfunction of visceral or somatic organs, then application of sauna is supposed to be done gradually to let patient body adapt to the new level of exposure to the heat. We have two types of the heat room. One is dry sauna, and another is steam room. They're both beneficial in their own ways. For the people who has disorder of pulmonary system, for example, steam room is preferable. For the people who has musculoskeletal problem and heart problem, dry sauna is actually more beneficial. However, they can even mix together. The point is, first of all, person who enters sauna or the steam room is supposed to take shower first. And it's better to sit on the first shelf. Don't go on the top. Higher you go, higher temperature. We need to train body to accept temperature and don't see it as a stress. Because when we enter area with the high temperature, the first reaction of the body is increasing stress level. If we go into the higher temperature within the room, then we expose already sympathetic nervous system into activation. Now, when you sit on the first shelf, be sure to have cold water with you, constantly sipping cold water while you're sitting on the shelf, and gently rub your skin to open capillaries. Without that, you will not get sweating and you will not create so-called natural detoxification. Natural detoxification means that the water you're drinking actually at some point start to pour through your capillaries in the skin, and that creates flush of entire body and eliminate toxins and metabolites. So the constant drinking of the water while in the sauna or in the steam room is critical to maintain proper circulation through the body and release toxins. How long to stay? The best judgment is personal sensation. There is no specific timetable. What you're looking for the first signs of overheating. When you have the signs of overheating, you exit the sauna, rest for several minutes. You can take colder shower or shower with decreased temperature, and then come back second time to sauna. And you come back second time, you're again sitting on the first shelf and you're rubbing gently your body in different parts. Let continue to sweat, and before you are leaving, you are making stretches of the skeletal muscles and joints which were exposed to the physical activity or as a part of rehabilitation. And final thing, if there is possibility to pour water on the rocks in the sauna, that needs to be done 2-3 minutes before you leaving after the second time. And this last dramatic impact of the high temperature finalize treatment in the sauna. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you and see you in the future. When we're talking about temperature within the sauna or the steam room, we're looking approximately 180-190 degrees of Fahrenheit or 80-90 degrees of Celsius. That gives enough temperature to produce impact of the heat, but at the same time it's not activate sympathetic nervous system and additionally create stress on the body. In any scenario, every first sign of overheating, that's when you need to leave sauna or the steam room and take temperature down. The best frequency of using sauna at least 1 time per week, and usually it needs to be done at the day when we are not exercising. It's supposed to be accompanied by exercise in the swimming pool or general relaxation, but no physical activity. There is no gym, there is no training. In such case, sauna associated with the day of recuperation, and that gives sauna benefits. If individual exercise first and he or she increase blood supply to the skeletal muscles, and skeletal muscles already get heavy, and when we go now to the sauna, the steam room, it's additionally increased vasodilation. So it's better to do sauna on the cold muscles and tissue which are not exposed to the physical activity. That gives general benefit, actually benefit body, not only musculoskeletal system. And this is why sauna need to be done 1 time per week, somewhere in the middle of the day, and it needs to be done while the individual is not engaged in the physical activity. If you're in the gym, you maybe saw people who actually do exercise and physical activity inside of the sauna or the steam room. That's a great mistake, because generally speaking, any physical activity dramatically increase blood circulation through the skeletal muscle and saturated them with the arterial venous blood. So while you engage in physical activity in the sauna, you additionally increase amount of blood saturated and stays within the skeletal muscles. Now, after you leaving the sauna, it's this extra blood, extra unnecessary vasodilation stays for a long period of time, delaying recovery of the muscles after physical activity. From that perspective, again, sauna supposed to be specifically associated with this day of recovery and rehabilitation, and in such case you will get best benefits. If we're talking about patients with musculoskeletal disorders, then application of sauna supposed to be correlated with the medical massage sessions, and it needs to be done between the sessions, not at the day of the treatment. In such case, therapist uses sauna as additional tool to enhance his or her therapy. And this is critical compared to the using sauna for the general healthy population, because it can be done 1 time per week, for example, on every Saturday, But when we're talking about the patients, then the application of sauna needs to be placed between the sessions, and that allows, from one point of view, get benefit on the sauna, and the secondarily enhance treatment conducted by the therapist to restore function, eliminate pain. However, before patient or healthy individual leaving the sauna, it is better to do stretches of the muscles and joints which were exposed to physical activity. For example, you yesterday trained upper body. Or if the patient has lower back pain or neck pain, then he or she needs to do stretches just before leaving sauna after second engagement. And that gives ability to use heat as a way to relax skeletal muscle and then engage in stretch to additionally reinforce therapist efforts with medical massage application. We get many questions about ideal rules of sauna application. One of these questions is how correlate food consumption and sauna application. Don't get to sauna on the full stomach. Be sure that you consume food after at least 1 hour after you finish sauna, and don't consume food before you're going there, because any additional food while you are expose yourself to the heat will actually slow down peristaltic movements of your gastrointestinal tract, and that will delay basic proper function of the body. So as you can see here, sauna is very powerful tool of rehabilitation and recovery and the therapy. You can share your own sauna experience in the comments and how you do and what your personal experience, and we can discuss that in exchange. Every time now when you go to sauna, remember what people say in Finland. Each day spent in sauna doesn't count as a day of lifespan. And that is real truth, which I experience on my own. Only sauna allowed me to treat 15-18 patients every day with medical massage therapy. And that's why I'm great advocate of this very powerful tool.